Endometriosis is one of the top causes of infertility on the planet. It takes doctors 9 to 11 years, or it takes patients 9 to 11 years to get a diagnosis from a physician. Majority of them go undiagnosed. Average age of diagnosis is about 32 because these patients have had either chronic pain, they're infertile, and they're bouncing from doctor to doctor until someone says, wait a minute, you have endometriosis. But I will tell you, majority of these patients, even under the care of a fertility doctor, get dismissed. So most of these patients, their most common symptom is pelvic pain, painful periods. I always say painful periods are not normal. And basically, these kids start having painful periods from a very young age. These are children who usually skip school. If they're in college, they can't go to class. They change their social calendar because of their period. Their plans changes. They can have a recurrent bladder infections, but really it's not a bladder infection.
It's
they have this
inflammation, right?
irritation of the bladder. So they get the symptoms of bladder infections. They go to the doctor. They keep getting antibiotics and they don't get better. And their culture is negative. Well, it's not a bladder infection. They have painful sex with deep penetration. They can have bloating. They can have back pain. And eventually it starts with pain around the period, but eventually it can grow into chronic pelvic pain and they experience pain throughout the month.
Yes.
So endometriosis patients present differently, and unfortunately, because their symptoms get dismissed, because they dismiss their pain, their parents dismiss it, and they're told that periods are painful. So they go on with this, and endometriosis eventually scars your pelvis, blocks your tubes, and increases your miscarriage risk, but most importantly, it destroys the egg count and quality. So
That's critical. That's really critical.